Hi, my name is Samantha Morrow, and my presentation is on cholelithiasis. Cholelithiasis is more commonly known as gallstones, and gallstones are hardened deposits of fluid within the gallbladder, and they can last for years or even be lifelong. And they can vary in size from the size of a grain of sand to the size of a golf ball. So the etiology is still unknown by doctors, but they do have some theories, such as your bile may have too much cholesterol, your bile may have too much bilirubin, or your gallbladder isn't emptying correctly. There are two types of gallstones, cholesterol gallstones, which are yellow to green in color, and they're typically the most common gallstones. They account for about 85% of all gallstones. And then there are also pigment gallstones, which are smaller in size. They tend to be darker colored, and they're usually made of bilirubin. And as you can see, I've included a picture of each one beside the names. Symptoms generally don't occur until they get to be larger in size, so more on that golf ball size end of the spectrum, and then they become lodged somewhere in your gallbladder. But when you do get symptoms, they can be like sudden and rapidly intensifying pain in the upper right portion of your abdomen, sudden and rapidly intensifying pain in the center of your abdomen just below the breastbone, back pain between your shoulder blades, pain in your right shoulder, clay-colored stools, nausea and vomiting. And you should definitely seek medical treatment if you have abdominal pain so intense that you can't sit still or find a comfortable position, high fever with chills, or if your skin is yellow and the whites of your eyes have turned yellow as well. There are several risk factors, such as being female, 60 or older, being an American Indian, being a Mexican American, being obese, having a high-fat diet, having a high cholesterol diet, a low-fiber diet, family history of gallstones, diabetes, losing weight too quickly, taking over-the-counter cholesterol-lowering drugs, taking drugs that contain estrogen, and having had a bone marrow or solid organ transplant recently, liver cirrhosis, or taking birth control. So some complications that can arise with cholelithiasis are inflammation of the gallbladder, blockage of the common bile duct, blockage of the pancreatic duct, and gallbladder cancer. Tests that are done for diagnosis of cholelithiasis are abdominal ultrasound or CT, a HIDA scan, MRI, ERCP, blood test, PTCA, endoscopic ultrasound, and a gallbladder radionuclide scan. Treatments are only necessary for gallstones that cause symptoms, and the most common treatment is a cholecystectomy, which is removal of the entire gallbladder. But sometimes doctors may opt to prescribe medications to dissolve the gallstones rather than remove the entire gallbladder. And another treatment option is called a lithotripsy, which is a procedure that uses focused ultrasound waves to break up the gallstones. And it's illustrated in the picture on the bottom right-hand corner. And it's also a treatment option that they use to break up kidney stones. Prevention. In most cases, you can't prevent gallstones, but if you're at risk, doctors do suggest not skipping meals, trying to lose weight slowly, and just generally trying to maintain a healthy weight, because being obese is one of the risk factors, and obviously being obese can lead to a lot of other diseases as well, so it's just a good idea in general. Here are my references. And thank you for watching my presentation, guys.